This morning I will talk about the recent study about nutrition intervention from longevity. If we review the trend of life expectancy, we can see from 1770, the general life expectancy around 30 years old. But after 1900, our life expectancy increased very much. And there were several drops, one from the World War and also the COVID we can see. And if we back to the potential risk factor for the life expectancy, we can see a lot of reasons can explain the advancement. Number factor influenced. We can see the vaccine and also we can see the vaccine like the smallpox and the water chloration and the antibiotics, and also like a surgery procedure and the preventive medicine extra. And mainly the technology for public health, and generally most all people can benefit from those factors. And currently public health more focused on the environmental health. We can see the green space and the human health are closely related and improve the life expectancy. And now is the time we study aging, and basic scientists and public health practitioners are more focused on the longevity. And all of us know each dimension for longevity is from different dimensions. This picture we are very familiar. If we see the life expectancy, we try to explain it from the basic science, like how to use the primary information and also antigenetic and also integrative information, like inflammation, allergy, and genomic instability, and telomere attribution, etc. Some study, especially for intervention, focus on calorie restriction. And one study focus on using the animal model, the calorie restriction, and also have a calorie restriction with once daily feeding. That means fasting with the calorie restriction. And we can see each intervention receive different benefit. Like from metabolic health, both improve glucose tolerance, but with combination with fasting, significantly improve insulin sensitivity. And calorie restriction cannot improve the reduced tau phosphorylation like alpha beta, and the fasting also reduce neuroinflammation. From a molecular pathway also suppress the T2RC1 signal and activated autophagy and increase brain-derived neurotrophic factor. In terms of cognitive function, also significantly improve the spatial reference memory and improve long-term memory. That means the calorie combined with fasting may receive high benefit. If we review the intervention, especially for animal study, using the dog, mice, and rats, or even monkeys. And we can see the local study intervention will focus on some pharmaceutical intervention in compare with the dietary restriction. The first part is the dietary restriction. We can see most dietary restriction received benefit. However, the metformin, the received benefit, but very moderate. If we use rapamycin, it's comparable with the dietary restriction. However, the message cannot be equally used for public and also medical community. For public health, we still should focus on lifestyle intervention and try to find a safe and the most effective strategy like balanced nutrition, moderate dietary restriction, or intermittent fasting and regular physical activity. However, we should more focus on healthy and promote healthy lifestyle and promote the healthy span. For scientific or medical community, maybe we should focus on research and drug development. Like rapamycin, the leading candidate may focus on develop side effect minimized analogs, not itself. For metformin management expectancy, it may benefit for metabolic health, but may be not reliable directly for life longevity. And for our community, we also continue to elucidate the dietary restriction, and then we find a convenient and feasible intervention approach. In terms of the intermittent fasting on health, aging, and disease, basic scientists give us a lot of strategy how to understand the basics behind the dietary restriction and fasting. And we can see the period of intermittent fasting combined with exercise can improve the many functions. However, the fasting period gives us a part-time for different organ to recovery. That means the injury moderately and the recovery and improve the longevity and also improve the function. And here for medical education, for public, and also different from physician, dietitian, and nurses. And we should focus on the lifestyle change. And each different strategy should be used for restrict dietary intake. For example, how to find a feasible and acceptable approach to improve the intervention effectiveness. However, if we review those literature, we have to be very cautious. Here, I would mention clinical studies have focused mainly on overweight younger and middle-aged adult. We cannot generate to other age group the benefit and safety of intermittent fasting that have been observed in those studies. Therefore, we should be more focused, make more cautious to using fasting or intermittent fasting. And behind of the intervention, we also can see why fasting in different time may have different impact. Like if we see the glucose and the lipids, and we can see the glucogenesis, glucogenolysis and glucogenesis and ketogenesis are very different for each organ. Therefore, the timing are very important for each organ. Therefore, for different patient or different clinical feature, we should have very different strategy. In overall, here, like using rapamycin or metformin or dietary restriction, including the intermittent fasting, still controversial, especially for lifestyle intervention. For public, it's a good standard and not non-pharmacal intervention for improved lifespan and health span. And if we review lots of intervention or clinical study, we also can see the telomere in different age. The lengths are very different. Especially, we can see the early age, the telomere is much longer and then quickly be shortened. And another fasting speed is in after the 80 years old. Therefore, it might be better to have early intervention, especially in the first 1,000 days. And in the second picture, we also can see there is the shortage of the telomere is not at one speed. The one in early stage, another is more than 80 years old. So for general population, we should use lifestyle intervention to reach 80 years old. Maybe after 80 years old can be more impacted by genetic factor. Most studies also give us hope for longevity. We can treat longevity as a disease. Some of the basic science study also target some genetic factor can prolong the lifespan of animals. Like if we have an inhibitor for LL11 and the mice lifestyle, the male life can be extended 20%. Therefore, such study gives us a hope to have more intervention targeting some specific area or genetic factors. And other intervention is very aggressive intervention, like the single-blinded randomized placebo control for therapeutic plasma exchange, like published in the Aging Cell, also show some sign. The therapeutic plasma exchange may improve the longevity. However, such interventions are very aggressive, may at this stage could be explained very cautiously. And also, some supplements, if we see some supplements like NR for intervention like the COPD inflammation, we also see the inflammation biomarker for COPD are improved. In terms of the dimension of the aging, the inflammation is a very important dimension. Therefore, intervention for the inflammation using the supplements is possible. Another part is about another intervention could be supported by some more aggressive intervention like the stem cell. However, currently, those evidence are relatively weak. if we review different countries about exposure of healthy and accelerate aging across different countries, and we also can see environmental factors like air pollution and income also closely and significantly associated with aging. Other factors like sleeping also can significantly impact aging. Other intervention also supported, like supplements of vitamin B and other factors, lifestyle factors. And in conclusion, still at this stage, public and academic community may have different strategy to adapt how to get a healthy aging, and more research should be cautiously and progressively conducted. Thank you.